Thank you, Federico, for sharing your story of courage and hope. And thank you to Dr. Suarez and Dr. Clark for your excellent presentations. In this next section, we're going to talk more about treatments. So I'd love to hear from each of you. What is one thing you would share with a NET patient who's starting to think about treatment options, whether this is after surgery or at a time when there's progression? Dr. Hendifar, let's start with you.
I would recommend that the patients consider going through each option and imagining what their future will be like on that specific treatment option and how that might play a role into the decision making.
My advice to a patient is that there are so many different treatment options that are available for patients with neuroendocrine tumors, and that no one neuroendocrine tumor patient is really the same, and everyone is completely different. So when you're getting various different types of opinions, you're going to have a lot of different choices. And the most important advice I would say is that you really have to have an open dialogue with your entire medical team to decide ultimately what's the right decision for you, because at the end of the day, you're the most important person in this journey.
So I would say, as I stated, I have been a NET patient for 16 years. And if there's one thing I've learned, it is there's rarely one way to proceed with treatment, like Dr. Lee just said. One of the best ways I would suggest to get some feedback is to have your case reviewed by the tumor board at the multidisciplinary tumor board at your institution, so that you can have a number of NET specialists weighing in on your treatment options, which will help you give you confidence in your future decisions.
Along the same lines as my fellow moderators, knowing that NETS is a marathon, you're going in with that mindset that you, along with your team, is making a customizable management system for you, and what's going to give you the best quality of life that fits your path on this journey.
Thank you, all of you, for your insights. So we're now excited to share the next set of speakers. Take it away, Dr. Hendifar.
Okay, I'm very happy to introduce Dr. HalfDonaldson, Professor of Oncology from Mayo Clinic. His talk is titled, When to Walk, Sprint, or Stand on the Sidelines, Surveillance, Maintenance, More Treatments.
And I'm very happy to welcome our radiology colleagues. So first up is going to be Dr. Tom Hope, who is a radiologist as well as nuclear medicine physician from UCSF, and has really led the way in terms of introduction of PRRT in the United States. So his talk is going to be on radiation safety with PRRT. In addition, I would also like to introduce Dr. Charles Nutting, who's an interventional radiologist from Endovascular Consultants of Colorado. And he's going to be really discussing the role of liver-directed therapy with the title of Liver-Directed Therapy for Neuroendocrine Tumors.